My name is Dr. Rashmi Navelkar. I am a consulting psychiatrist and we are here today to talk about how to manage if any person in the family is tested COVID positive. What are the do's and don'ts? As you all know, we are in the middle of a pandemic situation. We hear about growing number of cases and deaths every day. In this, if any member of the family is tested positive, it is natural for everyone to feel frantic and anxious about it. The only way to reduce this anxiety is to get your facts right. We know that COVID-19 is a viral infection. It is an airborne disease and it is spread by droplet infection. The droplets can vary in size from visible drops to invisible minor particles. These droplets are formed when we cough, sneeze or even talk loudly. They can even come out with saliva when we spit out. The minor particles in particular are dangerous because they can remain suspended in air for long hours and can travel up to 6 to 20 feet distance. Hence, the requirement of social distancing and wearing a mask becomes very important. However, its importance should be followed equally by every member in the family. It shouldn't be that some of them are taking these precautionary measures seriously while others are taking them casually. This typical chalta hai attitude is not going to help us in this situation. First and foremost, you have to involve everybody to devise a plan as to how you are going to manage this patient in the next few days. Especially children, because they tend to get anxious and worried and irritable when such things are there. You have to explain them in simpler terms and in a language that they understand that the said person is very sick due to this infection, and if you contact them, you will get sick too. So it is better to wait out for some days and then later you can talk to them. Whenever anybody is tested positive, depending upon their severity of symptoms, the risk factors involved, the comorbidities involved, their age and other factors, it is decided whether to admit them in the hospital or to manage them at home. Most of the patients that are asymptomatic or show mild symptoms can be safely managed at home. Now, for a patient to be managed at home, first and foremost, you have to put him in an isolation room. If you have a spare room, ideally with an attached toilet bathroom, all the more better. This infected person has to be kept in that room, isolated, and all his belongings should be kept separate. They should not be mixed with the rest of the family members. By belongings, I mean cup, spoon, plate, slippers, clothes, towel, bucket, everything possible that is going to be used by him or her should be kept separately. Those things should be kept in that same room and should not be brought out for the use by others. If suppose the isolation room or the separate toilet bathroom is not available, this situation becomes particularly challenging. So in such a case, when after the infected person has used the toilet, the next person who wants to use it has to wait it out as long as possible, delay going to the toilet. And also, the infected person who has used the toilet, before he leaves the toilet, he has to clean it with soap and water, preferably warm water, and then disinfect it. You can disinfect it by using disinfectant sprays that are available in the market. When the next person comes in, he has to cover his face with cloth and avoid contact to the surfaces as far as possible. Before use, he has to clean the toilet area, and after use, again the same. The rest of the people should not enter the isolation room unless it is absolutely necessary. For example, the only reason why anyone would enter the room is to collect say garbage or soil linen or to give food. However, whenever you enter the room of this infected person, make sure that before you enter, the person is wearing a mask. You have to, and when you enter, you yourself have to wear a mask, wear disposable gloves whenever possible, and maintain a safe distance of at least 6 feet from the patient. Now, when you are handling the contaminated or soiled linen of the patient or the clothes, you try and handle it as least as possible. Don't touch it again and again. It has to be collected separately in a bag and washed separately. Similarly, for the garbage bin, it has to be kept separate for the patient and separate for the rest of the family members. Once you come out, dispose those gloves as soon as possible, and after removing the gloves, they have to wash their hands with soap and water. Every time you enter the room and come out, this has to be done. Apart from this, now there are other common preventive measures that one has to follow in the household. Like the frequently touched surfaces need to be cleaned and disinfected frequently. Doorknobs, the tables, the tabletops, the cabinet handles, the faucets, the taps, etc. The keys. Always remember, before you touch your face with your hands should be washed. The same is applicable for the patient as well as others. For in case of the patient, now every time he sneezes or coughs, he has to wash his hands before he touches his face. Avoid use of air conditioning. They mainly keep the air cool by keeping the air particles suspended in it. So along with this, the virus also remains suspended in air for a long time. This increases the risk of infections. What the caregiver or the rest of the people in the family can do for the patient is that frequently remind him or her to hydrate themselves with water, juices, soups, whatever possible. Because during the infection, they tend to become lethargic, they neglect nutrition, they dehydrate very easily. So to prevent this. Another thing is you have to keep over-the-counter or frequently required medications handy. Something like a paracetamol, vitamin C or other regular medications of the person like antihypertensives or antidiabetics. Thirdly, you have to keep pets away from the infected person. Do not let the pet enter the isolation room because there is a risk of it infecting other healthy members of the family as well. Keep emergency numbers ready. In case there is worsening of health or developing, watch for warning signs like breathlessness, chest pain, the person's face turning blue, difficulty in breathing, loss of consciousness or confusion, etc. Devise a plan as to if such a thing occurs, who would take him to the hospital, arrange for members to do so, arrange for the car, the ambulance, etc. etc. Thank you.